One in 5 Canadian men will experience a mental health issue. Yet, mental illness in men often goes unnoticed. Men's depression is one such illness that is largely underdiagnosed, and there is a great need to address the discordant relationship between it and high male suicide rates. Recently, issues in Canadian men's illness, including depression and suicide, have received much-needed publicity and research funding. For example, Movember Canada has recognized men's mental health as a top priority. Beginning November 1st, 2013, Movember Canada will support 7 innovative Canadian-based initiatives focused on advancing men's mental health. One of the funded projects is the Masculinities and Men's Depression and Suicide Network, MD&S-Net, a collaborative of 15 researchers working with collaborators, graduates, and staff led by Dr. John Olive and Dr. John Ogrodniczuk at the University of British Columbia in Vancouver, with the overarching goal of promoting the mental health of men and their families. MD&S-Net will deliver 5 projects to support men who experience either or both of depression and suicidal thoughts. The first project, led by Dr. John Ogrodniczuk at UBC Psychiatry, will design and develop the help component of the Men's Depression Help Yourself website. This will feature online self-evaluation tools and management strategies. Project 2, led by Dr. Paul Gross at UBC Medicine's Department of Family Practice, will extend the existing Vancouver-based Dudes Club to other areas in British Columbia. The Dudes Club is a program for First Nations men who are at a high risk for depression or suicide. Project 3 will be conducted at the University of Manitoba by Dr. Mackenzie and focuses on older men, a vulnerable subgroup who experience high rates of depression and suicide. Specifically, a Men's Sheds toolkit will be developed to guide the expansion of Canadian men's sheds. This is a program that affords men important spaces to work, socialize, and discuss their experiences and challenges. Project 4 will be led by Dr. Marvin Westwood at UBC Counseling Psychology. Dr. Westwood and his team will take their existing Veterans Transition Program, a group-based intervention program that assists men in overcoming trauma and stress, and adapt it to 2 male subgroups. The 2 groups it will focus on are young college or university men between the ages of 20 and 30 who experience one or both of depression and suicidal thoughts, and older men with prostate cancer who experience one or both of depression and suicidal thoughts. Lastly, Project 5, led by Dr. John Olive, is called Man Up Against Suicide. Men who have experienced suicidal thoughts, as well as men and women who have lost a male peer, friend, or family member to suicide, will share and narrate photographs depicting their personal experiences. This project will act as a means to send a message to men who are at risk of suicide that there are alternatives to taking one's life. Selected photographs will be exhibited across Canada and made available online to destigmatize men's mental illness and raise awareness about suicide among men. Overall, the Men's Depression and Suicide Network, with the support of Movember Canada, will help change the face of men's mental health.